You've been recommended to have an open carpal tunnel release. I wanted to talk about what you can expect and what we can think about when you as you prepare for surgery. An open carpal tunnel release is done through a small incision in the palm about an inch or an inch and a half, basically about this long in the palm. This is done for compression of the median nerve at the wrist. What this does is basically releases the ligament on top of the nerve to give the nerve basically more room to breathe. When you think about preparing for this surgery, what we talk to patients about is what you should expect preoperatively. So you will be asked, depending on your physician, to do some wipes or washes of your hand the night before surgery. You will come in that day. This is an outpatient surgery. You should expect to spend about 3 hours at the outpatient surgery center, although actually the surgery itself will probably only take 10 to 15 minutes. You will come in that day, and the anesthesiologist may or may not talk to you depending on your options for how this surgery would be done. Surgery is either done generally under local anesthesia, so straight local given by the surgeon to numb up the area to allow you to have surgery without pain, or local with sedation where they start an IV and give you sedating medicine to allow you to have the surgery with not remembering the point where you get the injection for the local anesthesia and not remembering much of the surgery. Similar to what patients get during colonoscopy, if that is something you're familiar with. When that's done, the anesthesiologist would interview you if you're planning to have that type of sedation, or if you're going to have local. Sometimes this is done in the preoperative area about 10 to 15 minutes before surgery, or done in the operating room. What we expect then from surgery is you go into the operating room. That anesthesia is established either beforehand or is established right before the surgery. That incision is made over the area of the skin, taken through the layers, and the nerve itself exposed by releasing the ligament over the nerve. After that, the skin is closed. The skin is closed in a variety of ways depending on the surgeon. Some people use absorbable stitches that dissolve. Some people use stitches that have to come out later. When that's completed, generally a soft dressing is placed on the hand, and you can use the fingers. We never usually tie up the fingers, so you may use your hand after surgery. In terms of what you should expect post-operatively, that local anesthesia tends to last about 6 to 8 hours, depending on what anesthesia is used. So usually you should have no pain immediately after surgery. Sometimes the hand feels numb and tingly if a tourniquet or a blood pressure cuff is used to take the blood out of the arm so that visualization is better. And so often you wake up and the hand feels somewhat tingly and weird. That usually lasts about 15 minutes in the post-operative area. When you go home, you generally should expect to not have a lot of pain, at least initially. However, later, there may be some pain. Many patients tell me they have minimal pain or they have a little bit of aching. Most patients tell me they will take 1 to 2 pain medicine pills, if any, and some patients simply take just Tylenol. We generally give you a very limited prescription for pain medicine or narcotic pain medicine, depending on our discussions with you, because usually this is a small incision that's merely a little bit sore. In terms of post-operative treatment, depending on your surgeon, you may take your dressing off at 3 days if instructed to by your surgeon. You may need to leave your dressing on until seen post-operatively, either 1 to 2 weeks. In either case, you want to keep your incision clean, and you want to take care of it in the way that is prescribed by your doctor. You'll usually be seen post-operatively at 1 to 2 weeks to check the wound, to check you, to see how you are doing. Depending on the severity of your carpal tunnel, you might expect to be rid of your numbness and tingling and pain. You may not be if it's very severe carpal tunnel syndrome, as we usually discussed with you before surgery. People with very severe or bad carpal tunnel means the nerve is damaged, and we really can't change or reverse that damage. We can prevent further damage, and we can take the pressure off the nerve, and perhaps it will recover. In patients with earlier compression, where the nerve is just being squished by the ligament, generally releasing the ligament releases the compression and relieves symptoms. The other thing to mention post-operatively is a lifting restriction. Many people have a lifting restriction post-operatively of 2 to 4 weeks, ranging between 5 and 10 pounds. You're usually requested to take it easy with your hand in any case, to allow your pain to be a guide. So if you're doing something that makes your hand really sore, you want to back off that and stop doing it and relax and see if that calms down the hand. It's not unusual postoperatively to have occasional sharp, shocky feelings in the fingers or from the incision. This is usual. Usually this means that there's some swelling in the tissues that pushes up against a nerve. The nerve sends a little sharp shock, and then that stops. This is expected, and you should not worry when that occurs. In terms of your overall recovery, I generally advise patients that it usually takes up to 3 to 6 months to really feel the result of a carpal tunnel release. You usually feel pretty good early on, but your hand is still going to be sore and your palm can be sore for up to 3 months on and off. This isn't disabling soreness, but it is occasionally something at least you'll notice, and so that is why I advise patients that it often takes a while to really forget that you had surgery. So this is our advice on what happens with an open carpal tunnel release. Thank you.